Good evening, everyone. So today, welcome to the another episode of Let's Talk Health. So today, our session will be on the deficiency of vitamin D. To discuss with this, we have Dr. Aruna, senior consultant, rheumatologist. I would like to request Madam to give a glimpse on her expertise. Good evening, Madam.
Good evening. My name is Dr. Aruna Malipedi. I'm a senior consultant rheumatologist at Citizens Hospital. And my specialization is in dealing with rheumatological problems, including rheumatoid arthritis, lupus, ankylosing spondylitis, gout, and bone health like osteoporosis and vitamin D deficiencies.
So I have few questions to ask Madam.
Yes?
Sure. So first I wanted to know that what are the main symptoms of vitamin D deficiency and how to recognize them?
Okay. So India being a tropical country where we have sunlight almost throughout the year, about 2/3 of population has low vitamin D. Okay. Generally, most of the patients who have low vitamin D have no symptoms. And the symptoms depend on the age when the patient develops a vitamin D. Like if it happens in very young child, like under 1 year old, they can develop a condition called rickets, where they can have abnormality of the bones, bowing of the legs, poor strength in the bones, muscle weakness, muscle pain, bone pain, and so on. If it happens later in the life, they may not have any symptoms. Sometimes some people, when they have significant deficiencies, they can have symptoms like generalized weakness, lethargy, fatigue, tiredness, easily getting tired, bone pains, muscle pains. Some patients also notice that they have low mood, no energy. And it's been associated that vitamin D may have a role in other conditions like fighting with infections, autoimmune conditions, and so on.
Next question, ma'am. So what factor contributes to vitamin D deficiency and how to assess the risk?
So as I said before, vitamin D is called sunlight vitamin. So majority of the vitamin D comes from exposure to sunlight. So people who are not getting enough sunlight exposure are the most important group of people who get vitamin D deficiency. The amount of vitamin D which we get by consuming foods is very, very low. But people who don't take enough vitamin D in their food are also more prone to develop vitamin D deficiency. So if you know that you're not getting enough sunlight, you're not going out in the sunlight, and you're not getting enough vitamin D from the diet, you know that you are at high risk of developing vitamin D deficiency.
So next question, ma'am. So can you please explain the vital role of vitamin D in the body and its impact on overall health?
Okay. So the main role of vitamin D is to help the absorption of calcium and phosphorus from the gut. Okay. So the calcium, phosphorus, and vitamin D are very important to maintain the bones in a strong and healthy state. When we don't have enough vitamin D, enough calcium is not absorbed from the gut, and that will cause problems with bone mineralization, which means strengthening the bones basically. So like I said before, vitamin D may also play a significant role in fighting with infections, against autoimmune diseases, cardiovascular problems, diabetes, etc. But there is no conclusive evidence that it helps in these conditions. It has been implicated in helping with all these conditions.
So what is the recommended daily intake of vitamin D and how to ensure that we meet it through the diet and sunlight?
Okay. So the recommended dose depends on the age of the patient. For younger kids under 1 year, it is around 400 international units. For people up to 50 years old, it is around 600 to 800 international units. And people over 70 years, the recommendation is to consume 800 to 1000 international units of vitamin D. As we said before, the vitamin D main source is the sunlight. So the sunlight exposure should be around 10 to 20 minutes on the skin directly without any clothing and without any sunscreens. And ideally, it should be in the first half of the day. If we have darker skin, then we need more sunlight exposure to produce the vitamin D in the body. Coming to the next part, it is a diet. Diet, usually the foods which are rich in vitamin D include cod liver oil, fatty fish like salmon and tuna, and beef liver, cheese, mushroom, egg yellow. These are the main sources of vitamin D in the food.
My next question, ma'am. Are there specific group more prone to vitamin D deficiency, and should they consider or take some supplementation?
Okay. So people who don't get enough sunlight exposure are the biggest risk group who can develop vitamin D deficiency. Other people like elderly people who are housebound, who do not go outside, or people who are in the hospital environment are more prone to develop vitamin D deficiencies. There are other group of patients also, people who cannot absorb the calcium whatever they take from the gut, like when they have malabsorption with celiac disease or inflammatory bowel disease, pancreatic insufficiency, people who suffer with malnutrition are also at increased risk of developing vitamin D deficiency. Sometimes people who take certain type of medication may have interactions with the calcium and vitamin D and develop vitamin D deficiency. Medications like anti-seizure medication, antifungal medication, steroids, and some of the antiviral medication also can interfere with calcium and vitamin D metabolism. So these are the group of people who are at high risk. They should consult their doctor to see whether they need supplementation or not.
What is the process of tasting vitamin D? Like, how we will know that? And the level and the range of optimal for good health.
So vitamin D levels can be done with a very simple blood test. It can be done any time of the day. And the levels will be given as a report. And your optimal vitamin D level should be more than 30 nanograms per ml, 30.
So my next question will be, ma'am, if diagnosed with vitamin D deficiency, so what treatment are available and how soon can it be improved? Be like expected time.
Okay. So the treatment, the dose and the route depends on how low your vitamin D is. And also it depends on if you have any other conditions like malabsorption, or you suffer from any other medical conditions, or you're taking any other medicines and so on. So ideally, once you get the results of your vitamin D, you have to consult your doctor and find out which is the best route and how much dose of vitamin D you have to take and for how long. So it is better to consult your doctor and take the tablets or injections as suggested by your doctor.
So my next question will be, ma'am, are there any risk factors that for taking the vitamin supplements? So there is any side effects or like how we can minimize that?
Okay. So any medication has to be taken as suggested by the doctor. Taking it over the counter or taking it for a longer duration or the higher dose is not good for health. The same case applies for vitamin D also. It is not suggested to take high doses of vitamin D for longer periods of time because it can have some side effects. Especially it can lead to high calcium levels in the blood, which can cause problems in the body. So the recommended dose and the duration has to be decided by your doctor, and we suggest you stick with your doctor's advice.
So my last question will be, ma'am, like for long-term maintenance or what lifestyle change do you recommend us, like including diet and sunlight exposure?
Okay. So if you already have vitamin D deficiency, then you take the supplements and then bring the vitamin D levels to the normal. But we do have to maintain in the normal range. Otherwise, the body will use the vitamin D and the levels will fall again. So to maintain in the normal range, either you take adequately from the diet, like fish and cod liver oil are very rich in vitamin D. So you might want to include that frequently in your diet. Or you get sunlight exposure, like we said, 10 to 20 minutes of sunlight exposure every day on the direct skin. Okay. If you wear sunscreen and go out in the sun, that is going to block all the rays which are necessary to produce a vitamin D in the body. If despite doing all these things, you are more prone to develop vitamin D deficiency, then take supplements as advised by your doctor. But please do make sure that you get adequate physical activity, especially during the daytime where you can get sunlight exposure as well, and lead an active lifestyle.
Thank you, ma'am. Thank you so much.
Thank you very much.
So thank you, doctor. Thank you for your valuable inputs. So with this, we are closing this session today. Till then, goodbye. Take care.